everybody. Welcome to this press conference with Premier François Legault, Health Minister Christian Dubé, and Public Health Director Dr. Horacio Arruda. Mr. Legault, the floor is yours.
Bonjour tout le monde.
Hello, everybody. Perhaps before we talk about COVID, I would like to talk about what happened once again in Granby. There was a young person who was tortured by his mother. It's unbelievable. It is shocking. What I understand is that it happened before the Youth Protection in the Estrie region got involved. Lionel Carman is already reforming Youth Protection. We've already added some staff. We should have, in the next few days, a preliminary report of the Laurent Commission with recommendations. I just want to tell Quebecers that we will do all that we can. Our government will do everything that can possibly be done to protect children and to protect youth and to make sure that this no longer occurs, this type of situation. It is embarrassing for Quebec to hear stories, horror stories of this sort. I want to come back to the moral contract that we proposed to Quebecers last Thursday. It's a contract that is simple, but at the same time, I realize that it's not black and white. But let's talk about the two parts of the contract. On the one hand, we allow Quebecers 2 days, so 2 gatherings between the 24th and the 27th of December. I admit that at the beginning of last week, Public Health had talked about 4 days. Then they said it's better to have 2 days. So since the beginning, I've been listening to Public Health, and it's better to be more prudent than less prudent. And that is why we brought about this change where we went from 4 days to 2 days. So 2 days among the 4. You can have gatherings. Those who are like me, who are married, well, obviously there's 2 families. And I understand that we need 2 days. I will remind you that at the beginning of the discussions, which were in depth, we had considered the possibility of having 2 days at Christmas and 2 days at New Year's. That was excluded by Public Health because it posed more risk and more constraints when it came to the week before and the week after. So I'm very comfortable with the position of saying 2 gatherings maximum between the 24th and the 27th of December. So that part is very clear. The other part, where perhaps it's a bit more complicated, is that we have to be prudent, especially the week before, especially the week leading to Christmas. And how do we define prudent? Ideally, we stay home. If we stay home, that's the best solution. But I understand quite well that there are many Quebecers who must work the week leading to Christmas. And we must talk about minimizing risks. What does that mean? Well, essentially, it means to respect 2 very important measures: to always respect the 2-meter distance from other people and to wear a face covering when we are indoors. I also understand that there are certain categories of employees, like health workers, like people who work in daycares closely with children. It's more difficult for them to respect these measures. And I understand quite well that these are the people that we want to give time off because these people have been working very hard for 9 months. So if I had the choice, but I am not a magician, we need these people the week leading to Christmas. And I cannot have a decree that they can go to gatherings. You know, it's a question of risk management. And I am confident that all Quebecers will make the right decision. Of course, we have to take into account the age of the people that they will be meeting, et cetera, are some vulnerable? In the house, is it possible to respect the 2-meter distance, et cetera? But I just want to tell you that I understand that it's not black and white. There are some people who will have to ask themselves a question. Have I taken risks in the week leading to Christmas? And there are people for whom it's going to be more difficult to respect all the measures. But the choice that we've got is to prohibit all gatherings or to allow them to those who can gather. That is a choice that I've got. I am not a magician, I can't do miracles, and if somebody has a suggestion, I will be happy to hear it. The other thing that we said since the beginning, when we announced the moral contract, we said we will make sure that the situation is relatively under control by Christmas. So we are following the situation day to day, day after day. There are several considerations, the number of cases, the hospitalizations in each region of Quebec. Are we in control of the situation in the hospitals, etc.? So I just want to tell you that we will have a decision to make. For the time being, we are continuing with the plan. That means 2 gatherings. But there's a condition that has been there since the beginning, and that is that we have a certain control of the pandemic. In the meantime, the public health team is working on vaccination. I had a nice presentation. The minister's objective is to be ready at the beginning of January. Already we've got the priority list established. So who we'll begin with? We will begin with the residents in CHSLDs, the healthcare workers, and then afterwards, elderly people who live elsewhere than in a CHSLD. And there will be a general, Mr. Jérôme Gagnon, who's not an Army guy, who will work with Dr. Massé to control everything, with the CIS and the CIUSs they're in charge of the organization and the execution of this vaccination campaign. And I'm fully confident we could not have anybody better than Christian Dubé to supervise all of this. And the only thing that we're waiting for, and I've got a call tonight with Justin Trudeau, is that the federal government tells us when we will start to get these doses and how many we will get per week, because it's important. If we start getting them on the 1st of January or the 15th of January, the 1st of February, that's one thing. But how many will we be getting? Well, according to the number of doses that we'll get per week, we will need more or fewer employees in order to execute this campaign and to give the vaccinations. So we do need that information. And I know that I'm not the only premier, but all the premiers in the provinces are impatiently waiting for information from the federal government for the beginning date and how many doses we'll be getting per week. If we get 200,000 per week, it's not the same thing as if we get 500,000 per week. So I'll close by telling you that with the vaccination, there is hope. But the battle is not over. There are still some people who are attacking us. And it's important to respect the measures. Every action that we undertake in order to be more prudent is an action that can save lives. Not necessarily our own life, but all of the people who will be in contact with us. So there are some people who are at risk, and it's important that we respect the public health measures and to not let our guard down, even if we're nearing the end. And I'm coming back to what Dr. Fauci said last week. It's unfortunate in a war when we know that we're going to win, to be among the last who... So we have to be careful in the months to come.
want to say a few words about our moral contract for Christmas. We ask Quebecers to hold a maximum of 2 gatherings between December 24 and 27 with a maximum of 10 people at a time. This is the recommendation of public health authorities, and as I've been doing since the beginning of the pandemic, I'm following their advice. We also ask Quebecers to be careful 1 week before and 1 week after. It means staying home as much as possible, and when that's impossible, you should keep a distance of 2 meters with other people and wear a mask when you're indoors. I know there are people who have to work, people who have been working very hard for the past 9 months, but we have no magic answer. We need to minimize the risk as much as possible. We also need to keep the pandemic under control until Christmas. If our numbers increase too much, we won't allow gatherings. So we're following the situation very closely every day. Regarding the vaccination, our target is to be ready at the beginning of January. We'll first vaccinate people in senior homes, health workers, and elderly. But we're still waiting on Ottawa for the exact moment and the quantities. There is hope with the vaccine, but we have to stay very careful. We must continue all our efforts to save lives. Thank you.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. Mr. Legault, Mr. Dubé, Mr. Arruda will now answer questions. Question. Hello. I would like to know what explains the changes that you've proposed since last Thursday, the 4 days and the 2 days? What is this based on, essentially? Well, first of all, I'm not a specialist. At the beginning of last week, Public Health told me 4 days. At the end of last week, they told me 2 days. So the best person to answer this question is Dr. Arruda. We have to understand that when we said a period of 4 days, between the 24th and the 27th, it was to allow some flexibility, specifically for example, the parents who have shared custody of their children and who couldn't have their children on the date that they chose. People may have interpreted that the 4 days meant we can have gatherings as much as we want during those 4 days because it's allowed. So we clarified the intention was to decrease as much as possible the gatherings, and we said that we were recommending 2 gatherings, because with 2 gatherings, and here, when I talk about 2 gatherings, I don't mean lunch and breakfast and dinner. We're talking about one event, and that way we decrease the risk of contacts, because some people said to themselves, well, for 4 days we can celebrate as much as we want. And we believe that when we do this, well, we increase the risk. And as we're saying, we know that there will be some cases that will be transmitted. With community transmission, it's unthinkable that there will be no transmission at all, but we're trying to propose measures to decrease the risks. What are the indicators? And well, and when will you say we can go forward or we can't? Well, people always ask me for numbers, and I mentioned one the other time after a question from one of your colleagues. It's a set of indicators, because 1,000 cases of people who are young and who aren't very sick, who don't have an impact on hospitalizations, and we're still able to control the outbreaks because it's in specific environments and we can investigate. It's very different than 1,000 cases. Well, 3 elements, quickly. So the epidemiology, the capacity of the health networks to control the outbreaks, etc., the number of cases, the number of deaths, and of course, the capacity in healthcare settings. That is what will lead to a decision. Question? I just want to be sure. I know that I'm asking you to repeat yourself, but people who work the week before Christmas, you're telling them if you're very, very careful, take fewer risks but go anyways? Because I'm putting myself in their shoes. They may have listened to you and they still don't know if they're allowed to. Well, it becomes risk management. If you are a person who if you want a risk that's equal to zero, well, you're not going to go because you don't know if you will be contaminated. If you are able to tolerate a certain amount of risk, if you've respected all of the measures, you teleworked, for example, or you worked on site where there's a plexiglass, and the measures are adequate, there was no outbreak in your work environment. If you are careful in the week leading to Christmas, well, your risk continues to decrease. But if you ask me, is there a level that is perfect? Well, it's difficult to say. Each individual must look at their own circumstances. A person who's exposed, the elderly person, are they very sick? Will you really respect public health measures when you'll be with this person? Well, that's a judgment call. And what we tell people, generally speaking, is before the holidays, decrease significantly. It means only do the essential. Only do what you must do. Avoid contacts that are unnecessary, and that decreases a risk. And if you decrease the risk, you'll be less stressed. But that doesn't mean that during the gathering that you get close to people and you stay within 2 meters for hours and hours. Yes, there's a meal, but, you have to manage it. Because if you're asking me to tell you exactly what the risk is, well, it's so variable from one individual to the next. It requires a judgment call. But we do as few gatherings as possible before, then we have our 2 gatherings maximum. And if you can only have 1 gathering, perfect. If you can have 0 gatherings, wonderful. And then afterwards, the period after. And that is how people have to think about their situation. Mr. Legault, on another topic, the individual who killed 6 people in the Quebec mosque in January 2017, in your opinion, should he be entitled to release after 25 years? Well, the sentence was just reviewed. We will get familiar with it. Simon-Jean Barrette, the Minister for Justice, will read the decision, and we'll come back to you later on this. Question? Hello, gentlemen. Mr. Legault, you mentioned the healthcare professionals who cannot participate in gatherings this winter. Can you offer them something else, some time off, some vacation during the summer when there will be fewer cases, something to balance out the inconvenience that is imposed to them? I want to tell you right away that it's not black and white. It depends on what they do in the healthcare network and what were their contacts with patients. Was it COVID patients or non-COVID patients? So it's not black and white. We asked ourselves a question, actually, should there be some compensation? But now there are other people as well. I talked about daycares, but we could talk about police officers. There's all sorts of people who work at times that are not ideal. So for the time being, well, not for the time being, we will not have financial compensation or another kind of compensation. For Mr. Dubé, there are some residents in a CHSLD in Côte-Saint-Luc, in the Mennonites, if I'm not mistaken, who are asking for an intervention. They're asking for an intervention either with the Red Cross or with the SWAT teams. How do you see the situation in that CHSLD in particular? And how will you intervene? Well, I asked the Deputy Minister yesterday to look to see what was done up until now, because our procedure, we act locally, and then afterwards we send people. But it's always the same type of thing. We always need a few days, and we're a few hours away from getting the right diagnosis to see what happened. But I've asked Mr. Desharnais to act quickly if we have to send some personnel, some additional staff. But as I said, that's why over the past few weeks we were able to control the outbreaks in the CHSLDs with the 3 where they're in a delicate situation, the 3 CHSLDs, and this one is like the other ones, and we will treat it in the same way. So Mr. Desharnais will get back to me with a plan, but it's a question of hours. Question. Hello. You're proposing very strict measures for the 4 days during the holidays, and the Boxing Day falls within these 4 days. So the measures, the instructions that you're giving, how compatible are they with that day? Because there are many, many people who go to the malls, they're looking for deals. Will there not also be a risk that Boxing Day will become a super spreading event? Well, we are looking at, with the shopping centers and with the stores, we're trying to see how can we make sure that the 2 meters is always respected, including for Boxing Day. We may add some measures to make sure that there's a maximum capacity, a maximum limit on the number of people in a store, and that there be police officers who will make sure that these measures are respected. But it is currently part of what we are looking at Boxing Day. Earlier you said that you will have a decision to make concerning the 4 days and the rules that you've already put in place to see if they will hold or if you will add some. When exactly will you be making this decision? Is it in the 14 days before the holidays, and what are the current probabilities that the current scenario will still be holding at that time? Perhaps that's for Mr. Arruda, but well, I don't think that we can, unless you've got a crystal ball, I don't think that we're able to give you some probabilities and ask for the date. Well, I would tell you before Christmas. Question. Hello, Mr. Premier. Mr. Dubé, Mr. Arruda. 1,464 cases today. That is a single-day record since the beginning of the pandemic. I don't think that we've reached that peak even during the first wave. So the hospitalizations are increasing in Montreal. Mrs. Drouin is worried about this. Given the current situation, if the current situation stays as it is, it would be extremely difficult, given this situation, to authorize gatherings at Christmas, no? Well, listen, we have to understand that there are 3 steps. There's the cases, the hospitalizations, and eventually the deaths. Today, the hospitalizations are at a level that can be controlled. However, if we've got 1,400, because now we have to be prudent, right? First of all, we have to look at the number of tests as well. We're doing a lot of tests. So we have to take that into account as well. We have to look at the percentage of positive tests. Where were these tests done? Is it in places where there were outbreaks, etc.? So I think that it's too early today to answer that question. What is encouraging is that the situation in the hospitals is still under control. But it's possible that the increase in cases in a few weeks will lead to an increase in hospitalizations. Go ahead, Christian. I would add, Mr. Lacroix, and I know that you love numbers, you're like me. We had exactly the same situation around 10 days ago. We were at 1,400 cases. And as you know, it's the rolling average that we have to look at. When we had, I don't remember exactly what date it was, I can give it to you, but it was around 10 days ago, and I was looking at it this morning. We had, sometimes there's, it falls on a weekend, there's tests, there's all sorts of factors where it leads to like a perfect storm on a given day. But we have to look at the trends. Of 1,400 cases for me today, is it the same situation as 10 days ago where things stabilize afterwards, or are we seeing a trend? This is the point that I would make. So 1,400, I agree with you that we haven't seen that often, but we have seen it and things stabilized afterwards. That's why I'm going to wait, and that is what we are looking at. We look at the components of the 1,400 as well. We're looking, is it a regional effect? Is there an environment effect? And the last point as well, a few days ago, we saw right away that there was an issue in what I call the mix, right? The environment, it was the RPAs. And right away we told you, and we said, listen, there's something happening in the RPAs. We have to tighten up the controls in the RPAs. So I would tell you the same thing today. Now we're looking at the trends. The 1,400, will it stabilize? Or? So I appreciate your question, but currently it's a bit too soon to make a decision based on that factor. When you look at this, Mr. Legault, because now you're being told that perhaps you went too quickly a month and a half before Christmas, and you said, well, here's the plan that we're proposing, and there were a few communication errors from what we understand, the 4 gatherings, the 2 gatherings, etc. Did you go too quickly? When you analyze all of this, do you say to yourself, perhaps we should have waited a bit longer, a few weeks perhaps, to see the trend, to see how things are developing, so that you can present your plan for the holiday season? Well, I would invite you, Mr. Lacroix, to go listen to your questions. Go hear your questions and the opposition's question a week ago before we announced that plan. People were saying, well, Christmas is coming quickly. We need to know, how do we organize ourselves? How will things happen? Can we have people in our homes? Give us some time to plan. So I understand that now there are some people who are saying the opposite. But the idea of communicating this plan was so that people could plan, so that they could see, what are we doing with the schools? What are we doing with the businesses? What are we doing with the week where we're asking you to be prudent? So that was the idea. The idea was to give a bit more predictability. But as soon as I said it last Thursday, I put a big if the situation is maintained, if we keep control of the pandemic. And I'm sure that today, if we had not announced our plan for Christmas, most of the questions would have been to that effect. When are you going to announce your plan for Christmas? Question? I know, Mr. Legault, that you like to compare yourself to other provinces, and we can see that in Ontario, it's no gatherings at Christmas. When you talk about the big if, are you asking Quebecers to manage their expectations or to even have lower expectations? Well, Quebecers have the answer in their hands, right? The more Quebecers are prudent until Christmas, well, the higher the chances that we will be able to have these 2 gatherings. Now, when we look at what is proposed in Ontario, what's proposed in Manitoba, we have to look at the whole picture. We have to look at what they're asking for the week before, which is what we're doing with the schools, what they're doing with the testing and the contact tracing, etc. And I'm comfortable with the position that we've taken. I think it's a position that is well-balanced and that also takes into account the mental health of the population, because I'm very conscious of the fact that currently there's a lot of Quebecers who are having a hard time. And as I said last week, seeing our family can give us energy to get through the next few months that we've got before the vaccine. So there's all sorts of considerations, and I think that the situations are different from one province to the next. There was 1 week in Ontario where their restaurants and their gyms were open 1 week ago. So that's what we have to look at. We have to look at the big picture. You announced last week the 4 days with the gatherings and all of this. When you do this 1 month before Christmas, even if you say that it's a moral contract and that it will depend on several elements, are you not making a mistake? Because afterwards, if you take a step back, perhaps people will want to have their gatherings anyways. Well, it's a consideration, actually. When we looked at do we allow gatherings or not, we can ask ourselves, well, if we had said no gatherings during the holidays, well, perhaps there are some people who would not have respected the rules because they would have found that it's too severe. And we would not have had the opportunity to put in place a framework that we've proposed. That is, be careful the week before and the week after. Maximum 10 people, maximum 2 gatherings. I think that there's an advantage as well to well-framing what we are proposing for Christmas. Question? My first question is for Dr. Arruda. Mr. Arruda, the official opposition at the National Assembly has been saying for a few days they've been talking about what Dr. Fauci is saying concerning tests with asymptomatic people. The Premier seemed to suggest during the question period that you thought it wasn't necessarily a good idea. Can you explain why your opinion is different from Dr. Fauci's? Well, first of all, we have to understand that when we're talking about testing asymptomatic people, well, we do test asymptomatic people. We have to know what Dr. Fauci is talking about exactly. Here in Quebec, we've got an experts committee. We've got clinicians, we've got people from public health, lab people who have looked at all of the categories, right? The most important thing is to test people who have symptoms, the asymptomatic contacts. So we're testing all sorts of asymptomatic people. Now the question is that there are categories, and we even did some analyses. We were testing asymptomatic people, and we found that we weren't detecting a lot of cases with that method. So we adapted the system to our epidemiology. We are not against Dr. Fauci. It's not the same position. I would have to explain to Dr. Fauci the logic that we used. We use the test that we've got. We've increased our capacity in order to better detect where there will be impacts and interventions. Second question for Mr. Premier concerning the gatherings in shopping centres. So the Boxing Day question that was mentioned earlier by one of my colleagues. Currently, in the plans that you're analyzing, are you thinking about closing shopping centres from the 24th to the 27th, or during the period where for the week before and after the gatherings? Well, what we're looking at right now with the owners of shopping centres, we want to make sure that the 2 meters is respected and that people are wearing their masks. And we're also looking with police forces to make sure that the measures are respected in shopping centres. But I've got certain worries. I'm told that in certain shopping centres, there are people who will talk in groups and they don't respect the 2 meter distance. So for the time being, we don't think that we will close the shopping centres. What we think is that we want to put in place some very clear rules for the owners and make sure that the owners, that the police officers will be there to make sure the measures are respected. Question. I want to talk about the Montreal Casino. Did the government close its eyes because it paid off to launder the mafia's money? Well, I learned this personally in the newspaper this morning. I think it's terrible to say that we almost encourage people in organized crime to launder money and that we even offer them presents. I've got a real hard time with that. I think that the role of Law Quebec should be to do some verifications to make sure that the people who come to the casino are not there to launder money. So the Minister of Finance has asked for a report, has asked for clear answers from Law Quebec, and depending on the clarity of these answers, well, we will decide the next steps. But I think it's unacceptable. Law Quebec cannot be there to help organized crime to launder money. You refused this morning an independent public inquiry from the opposition. You're asking for a report. We know that often reports are put on a shelf and nothing happens. Are you asking the RCMP to get involved? Or are you asking LUPAC to get involved? Listen, what I want to know before I make a decision, I want to have Law Quebec's version of facts. What are the measures that are in place to make sure that there is no money laundering in our casinos? Once I get that answer, well then I'll be able to tell you what are the next steps. Question? How will you make sure, Mr. Legault, that Law Quebec will not once again give privilege cards to mafiosos? Well, listen, we've got to have some trust, and we're going to make sure that there are no privilege cards that are given to people in organized crime who come to launder their money. Well, it's going to be part of the discussions that we'll have with Law Quebec's management, but clearly there have to be some measures in place in order to make sure. Perhaps there'll be somebody who will infiltrate the casino and we don't know that they're from organized crime. I don't know, but we have to be able to put everything in place so that there is nobody from organized crime that use the casinos to launder money. Now, on the topic of the pandemic, I would like you to talk about, last week you said, well, we've asked police officers for a plan for the squads to make sure that there are no gatherings for New Year's. What can you tell us on this? In the homes, how will the police officers work? Will there be some additional staff? How is this going to work? Well, we're still in discussions with the different police forces. What we've asked them is to propose a plan for the 31st of December, for the 1st of January, and also for Boxing Day, because we're expecting, and usually there's way too many people in the stores and in the shopping centers. It's the 26th of December. So we are in discussions. As soon as we have the plan and that it's approved by the police forces, well, we'll share it with you. We will now go to the English questions.
Two questions. First of all, thank you, Mr. Premier. I'm going to have to start with the ugly news of Granby. I understand the tragedy took place before the DPG over there was put under trusteeship, but it also brings the focus on the work of the DPG across the province. You can't always focus on each case. I'm sure there are some that slip under the cracks, but your overall feeling about the well-being of children that are otherwise under threat?
Okay, but first, it's terrible what happened. I'm shy. Lionel Carman already started first adding many employees in the different DPG. We've put in place a commission with Régine Laurent. We must have in the next few days preliminary reports with some recommendations, and my intention is to do all what's possible to be done in order that it doesn't happen anymore. So we'll put in place what is needed. And you're right, it happened before the DPG be on trusteeship, and we're helping them right now. So we've sent some experts to change the situation because it's the second terrible situation that we see in Estrie. So we're working on that.
My second question is for Dr. Arruda. Mr. Premier explained in details how he will roll out the vaccination in January. And you're probably as outraged as most scientists about the number of people who do not trust vaccine, even though we know that vaccines saved millions of lives in the 20th century. How do you convince people who say, no, this vaccine, untested, processed too fast, dangerous, don't touch it? How will you convince the population that they're better off taking that vaccine?
It's a very important question because anti-vaccination groups are going to be there as they are for other vaccines. I think it's based, I would say, in communication and also getting into mobilization of communities to really explain the situation. I think we're going to have a big campaign. We're going to have different doctors which are not the government, who will be with us to explain what are the facts, what is not the facts. And I would say that even if there is those tensions and those people in Quebec, we used to have good coverage compared to other places like in France, where it's very difficult. So it's based on, I would say, communication. It's based on communicating the no side effects happening. It's based on a confidence that we're going to have a trust with them. So there's always going to be some resistant people, but if we convince a maximum, that's going to be a good issue.
Cathy Sonnet, CBC.
Good afternoon to all of you. Mr. Legault, you said a few times during the press conference that the situation for the coming holidays, it's not black and white. So what are your advice, your tips for Quebecers that are really having a hard time following the clarifications on this contract? What would you tell them? Because it may create more stress than you would have liked to create it among families.
Okay. The first part of the contract is quite simple. You can have gatherings 2 times between 24 and 27 of December. So that is very clear. The other side is a question of managing the risk. The best way to put the risk very low is to stay at home the week before Christmas. That's the best one. I know very well that many people cannot do that. So for these people, what is key is really to respect the 2 meters and to wear the mask. It may happen that for some of the people, it's tough to respect those 2 measures. For example, people working in the healthcare system or working with children, it's not easy. So, of course, the higher is the risk, the more careful you have to be when you choose who you'll meet in those 2 gatherings. Is it somebody young, or is it your mother or great-mothers having 90 years old? The more they are vulnerable, the lower you must try to keep your risk. So that's where it's not black and white, it's gray, but you always have the choice not to have any gatherings.
So it's the responsibility of every citizen.
Yeah.
Did you come up with, or are you still thinking about screening? Some people will think about getting tested before going there. So did you? Is there like a solution that you have on this side to stop people from going?
No, because like Dr. Arruda explained very often, it's a bad idea to have a test just before the party, because you may have a negative result and be contagious, because it takes 7 days to get the symptoms. So the best you can do is make sure you don't take any risk 7 days before the party. And it's not a party, it's a meeting, a gatherings.
Philippe Autier, The Gazette. Good day, Mr. Legault and Mr. Arruda, Mr. Dubé. Is there any possibility, you're warning people that the Christmas thing is on the line. Is there any need or any plan to add additional measures between now and, everybody's talking about this magic date of December 11th, when you get the 14-day cycle of numbers. Any thoughts of adding?
We don't have this kind of intention right now, no. Yeah.
Okay. And for Mr. Dubé, can you explain us a little bit further the logistics of the how you're going to do the vaccine rollout and how prepared we are when the magic vaccine arrives?
Yeah. Well, let's start with the conclusion. We need to be ready, and we will be ready January 1st. And the best way to be ready is having a look at the practice we're making, if I can use that word, is what we do for the influenza right now. Because the first thing, and this is what I'm being asked by the Premier, is how many can we do? And right now we do just over 200,000 vaccination per week, which is really good. And we need to make sure that if we needed more of those vaccination per week, that we would have the staff, we would have the facilities, we would have all those resources. So, for example, I think that the leverage that we had, that's a good, an important point, was to put in place months and months ago, because we've been working on that for quite some time, is the support and the help that we had, the assistance from the pharmacists, from the drugstore, and those pharmacists are giving us a lot of leverage. And this is only one type of professional. So one of the things that we're discussing right now is other professional that could help. I don't think we need them in the first week. I would love to be able to be at 500,000 a week in the first week, but we'll make sure that we can have this ramp up very quickly, and this is what we need to do. But I think just to reassure citizens, we will be able to vaccinate Jan 1st. That's for clear, and that's the reason Jérôme Gagnon, that the Premier has referred, he has seen a lot in difficult situation. We're bringing staff just to make sure that we have really an operational view with this group, and that is supported by a strategic view on public health. I think that the balance is really, do we have the people on the ground? The answer is yes. Can we do more than 200 per week? The answer is yes. And we will have all the professionals that will be needed to make sure that we have this group. Now, on the infrastructure, which is important, and we had that discussion, maybe that's a long answer, but I think on the infrastructure, that's important as well, because as you know, Pfizer is proposing their vaccine in a certain type of box that will be in dry ice and that sort of thing. So we have all sorts of facilities that we need to put in front of them, because my biggest point on the infrastructure, I want to make sure that if they say we're there on January 1st, is that we have the infrastructure, that the freezer are there, that we have the logistics to support them. So this is something that we concentrate on right now to be ready on Jan 1st.
Thank you. Jean-Vincent Verville, Global News.
So, Mr. Premier, how do you feel about elderly resident leaving CHSLD or RPA for Christmas dinner?
Well, Christian will answer you.
Well, that's a good question. I think we need to clarify things, and that will be done in a guide that is being finalized in the coming days. I think that I would say at the latest early next week we will have this guide, and because I saw on the email coming here that we were receiving a draft on it. So because I think it's important, and I've said that in the Salon Bleu in the last few days, there is a big difference in moving somebody from a CHSLD and from an RPA. And RPA, long-term, what's the? Long-term care. Those people that are mobile and that can go in and out. We're dealing with two different issues. So what we decided to do, instead of having just a discussion on those rules, we are publicizing a very clear guide that has been developed with public health. And I think when we see that, and people will have very clear instruction, can we visit people in CHSLD? Can they be moved? I doubt very much that we'll move people from CHSLD given their mobility issues and given their vulnerability. And that's the reason I think I would like to wait for this guide to compare those different situations.
I have a question for Monsieur Legault, but can you just repeat in French what you said about the very important situation at the geriatric center in Côte-Saint-Luc, please?
En fait, in French or in English?
In English.
In English, sorry.
I wonder myself.
Why did I ask in French? I did.
Yeah, but I did that a couple of times, answering in French to an English question, right? So I've done that before, so don't worry. That's interesting because I said earlier that I asked for a clear exam on this one because this is a CHSLD that had some issue in the first wave, and especially when there are situations, I want to make sure I have a real, not only hearing that everything is going well, I just want to have the fun. I know that some journalists, and that's the reason I want to be prudent, some journalists have been there, they have visited, and they were quite pleased, I think, of what they've seen. But instead of relying on only a review, an outside review, I ask Daniel Desharnais, who is responsible for all the PCE, the prevention and control of infection, to give me a very detailed report, and that's what I'm waiting to get it. But I'm pleased that some people that have been there, and I respect them very much, said that they were appreciative of the controls there.
Why have you changed your mind on school board election 1 week after?
Because the rule we just announced last Thursday, we said that we are asking people for the week before Christmas to minimize the risk of meeting other people. So it just makes sense that the election of the English School Board be postponed.
Merci.
Merci tout le monde.
Oui, juste un moment, Monsieur Legault. On a une
Just a
question.
moment, Mr. Legault. We've got a question from a reporter.
Il semble que plusieurs Québécois
Several Quebecers do not understand the moral contract because some catering services say that they're getting orders for 40 people for the 24th of December. So are you confident that Quebecers will truly respect your moral contract? And what will be the consequences for those who do not respect the measures? I keep hearing the same example. It's always 40 people. It's not 30 or 50. It's always 40. So I don't know if it's always the same caterer and always the same order that we've been talking about for the past week. But yes, I have confidence that Quebecers will understand that we cannot be more than 10 people in a home and that we must be prudent. I am trusting Quebecers. So no fines, no visits from the police, no repression if... well, that's not what I said. Well, what are you saying then? Listen, there are some rules in place, and when people do not respect the rules, well, there could be consequences and fines. Very well. Thank you, everybody.